This young lady is, I did her rhinoplasty actually a few years ago. It looks very natural. She's happy with that. I've come back to help reshape her lower face. She's 7 days out from this procedure. What I've done is I've done a medium extended anatomic silicone implant. I like extended anatomics because they really build the entire frontal jawline. The conform silicone is great because if for any reason she hated it, which she won't, I could easily remove it. Really low risk of infection. I've only had one in 20 years. Stays very, very stable, and it doesn't cause significant bone resorption. So really, really natural contouring. I've done a deep neck lift. There's a little bit of swelling underneath the neck right now, but if you look at the before photos, you see a big difference already. Essentially what I've done here is I've done excision of the submandibular glands, just the portion that's below the mylohyoid muscle, that's below the mandible portion. I use a Covidian instrument to help remove these glands so that there is almost, I shouldn't say zero, but pretty darn close, and I've never seen it, risk of bleeding or salivary leak from that. It's something you read about. So I've taken out the portion that was sagging underneath the neck, and this is why liposuction really is a complete failure. And even if this is a younger lady, she's 36, so even if I had a 20% improvement by liposuctioning the subcutaneous fat over her lifetime, this would actually cause premature aging because you've just exposed the bands underneath, and that's a real problem. So I've taken very, very small amount of subcutaneous fat out, just areas that didn't quite still, it made it still a little bit of bulginess, so I was very, very small degree of subcutaneous fat. Most everything was subplatysmal, or in other words, underneath, inside the platysma. Some digastric muscles shaved to help smooth that out. The digastric muscles are really muscles that we don't use, and I'm only shaving just the maybe about 30% of the anterior belly of the digastric muscle to create better contouring in the neck. And then I have done a microliposuction of the jowl itself using a 1.2 millimeter cannula to help reduce that. And then I did a buccal fat excision, and I've seen way too many oversculpted buccal fats. In fact, I saw a lady yesterday was way over hollowed. And the way that I access the buccal fat here, I can do it transorally, but if I'm through a deep plane facelift, below the SMAS muscle resides the buccal fat. It sits right there. So this side didn't have as much fat as the other side, but I've taken that out. And the patient's even commented right now that at a week she barely can see her incision, which I think you can barely see. This is just where the drain was, so there's a little black dot where the drain came out, which is painless. But this is my incision around the ear. What she had, even though she's a younger lady, I did a deep plane facelift, not because, you know, for a 36-year-old Asian woman, she's not really sagging, but it's for facial recontouring, and it's to tighten up the jawline. So essentially, what the deep plane facelift means is I've released all the deep ligaments. It also gives me access to the buccal fat, very, very easy access to that zone. And then I have lifted up the tissues. Now, what I've also done for her here is redefine the outer mandible. And the way that I redefine the outer mandible is through a few techniques. So first of all, just a removal of the gland, the portion that's sagging. And you see people that have way over-reduced glands where the neck is over-hollow. That's really bad too. You don't want that. But by removing the gland, it doesn't just help the neck. People think that's just improvement of the neck. But by bringing the gland in, I automatically define the mandible. So that's a really beautiful way to define that outer jawline, is actually the contouring of that submandibular gland. The second thing is that what I do is I split the platysma. The platysma is the muscle that sags here when we get older. Of course, in a young lady like her, she's not really sagging. She's just born with more fullness. So what I do is I split the platysma muscle along the mandibular border, tack the neck portion here to give her a really nice tight neck. But then what it does is it also defines that posterior mandible. So if you're an older individual, maybe in the 50s or 60s, looking at your jawline, oftentimes what we do is we focus on the jowl and say, oh, we have a big jowl. Now for her, she had a little bit of a jowl. I've suctioned that out and released the ligaments and then tightened it. But I've also done a platysmal split here so that this defines more of the mandibular border across that area. Incisions, the reason they're so hard to see is that they're all curvilinear. In other words, there are no straight lines. And also, what I've done is I've done what's called a trichophytic incision, which means along the hairline, I have actually intentionally transected one row of hairs along both hair areas. That way, the hairs will grow through the scar and create a very difficult visualization of this. I'm using dissolvable stitches. She's from out of town. I didn't do that just for her because she's out of town, but because it heals better. And you can even see the stitches are actually still in there, but you cannot see them barely from this perspective, from a social distance, and simply because they're very, very tiny. They're flesh colored, and even in African Americans, they don't really see very much. But they should heal very, very well for her. There's also no hair loss, and a lot of times when you see facelifts, all this hair has been taken out, and and I do a lot of hair transplants. This hair border sits way back here, and it looks absolutely crazy. Or there's an incision that goes up to this area, which is very visible. So for all those things, she could wear her hair up, she could wear her hair short, and she's not going to have any visible scars that anyone can see. Now the incision down here is lower. This is an incision that sits way down here because I have to access the glands, but I haven't had a patient complain of it because I've taken that incision, brought it way up here, so that incision just looks like a natural crease as it fades away. So in summary, what I've done for her is I've done micro liposuction of the jowl, I've done a medium extended anatomic chin implant, I've done buccal fat reduction. I shouldn't say just elimination, but reduction. I've done a submandibular gland, digastric, subplatysmal, and some supraplatysmal fat resection. I've done a platysmoplasty and a deep plane facelift extended with a split of the platysma muscle.